Well, as we heard in that report, the cholera outbreak has also hit Zimbabwe hard, with over 20,000 infections and 370 deaths reported across the country. Zimbabwe has secured 2.3 million cholera vaccine doses from the World Health Organization, with the first phase of a vaccination campaign set to be rolled out in hotspot areas on Monday. Well, Farai Makotuya joins us live from Harare now. Hi there, Farai. Just speak to us about what's going on. We have mentioned the outbreak there, the extent of it, and that vaccination rollout. Give us an update of the latest.
Well, indeed, the outbreak continues to be a source of great concern for authorities here. Those cases continue being recorded in all provinces of the country now. More than 20,000 cases have been recorded across the country, and it's virtually in all provinces of the country. At least a single case has been recorded in every single province, but the hotspot remains in densely populated areas, particularly here in Harare, the capital city, in suburbs where people are very densely populated, where there's poor sanitation, where there's a shortage of water being delivered into people's homes. So that is the key situation. That is the key challenge that people are facing here, to try and contain this outbreak before it becomes more severe. And as you said, those vaccines are being rolled out in an effort to try and do that and ensure that it doesn't reach the levels that were reached, very catastrophic and devastating levels in 2008, where more than 4,000 people lost their lives. Anna.
Other than that vaccine rollout that you've spoken about, Farai, what else are you hearing authorities and Zimbabweans are doing to respond to this outbreak?
Well, the vaccine rollout, as you mentioned, will begin tomorrow. It is targeting anyone, children from the age of 1 year old right up to adults. And those people will be getting those doses, a single dose, which should give them protection for about 6 months. And the rollout will begin in the worst affected areas, those hotspots that I've mentioned, particularly here in Harare and in other provinces. As more doses come in, the catchment area, or the area that will be vaccinated, will be increased. But in addition to that, the authorities are also stepping up delivery of clean water. So the ministry responsible for water is saying that it will drill boreholes in areas that don't have access to water, or increase the number of boreholes so people have access to safe water. There's also a big drive to encourage people to report early if they have any symptoms, so that they don't report late, and also just increase awareness, encourage people to take those precautions and measures, good sanitation, so that they don't get infected.
So, Farai, I know that you've been keeping an eye on what's happening in Zambia right now, as that country also battles a cholera outbreak. From what you're hearing, Farai, what's the latest from Zambia when it comes to containing this outbreak as well?
Well, Zambia began its vaccination exercise a bit earlier than Zimbabwe. They got their vaccines a couple of weeks ago and started vaccinating people in, again, the worst affected areas. I think, as you mentioned, the challenge is that these cholera vaccines are in short supplies because there's a resurgence of this disease. So they got a number of vaccines, and they are, again, vaccinating people in the worst affected areas. In addition to that, there's a big drive, including donor partners and agencies, to educate community health workers, people in communities, to go out and spread the word, to spread the message of, use safe water, boil your water, treat your water, and just practice good sanitation. There's also a step up and drive in terms of clearing refuse that hasn't been collected, and also trying to decongest some of these densely populated areas. So a big drive there in Zambia to make sure that, what we've seen so far, they can lower that case count, and it's particularly through, obviously, vaccinations, but that isn't the silver bullet. There's also a need to address the structural issues which the government is seized with, and that is making sure that there's provision of safe water, that some of these structural issues are addressed, and that is what we understand Zambia is doing right now to make sure that they can contain this outbreak.
Farai, thank you so much for all those details. Farai Makotuya speaking to us from Zimbabwe's capital, Harare.